No, no, is it Noel? Can you hear us okay?
Yep, I can hear great. Thank you.
Okay, looks like Benji.
Yes, I can hear you okay.
Okay, and Sarah? Sarah?
Yes, I can hear you.
Okay, thank you. I'm not gonna turn the lights off because it's 9 o'clock, so. Thanks, Okay.
Okay. I'd like to call to order this July 31st, 2025 meeting of the Healthcare Advisory Committee. Kim, do you want me to do roll call or do you want to do it?
I can if you want.
Sure.
Okay. Simpson?
Here.
Zingy?
Here.
Robinson?
Here.
Cook?
Here.
Smith?
Here.
Horton?
Here.
That's it.
Okay, thank you. We do not have any communications added to the agenda that I'm aware of. We provided the hack and posted online the agenda and materials that we had in advance. So that moves us on to agenda item number 4, which is persons to be heard. We don't have a sign up list, so if there's anybody in the audience that would like to address the Healthcare Advisory Committee, we'll start with the folks in the room, and then if there's anybody online that would like to address the Healthcare Advisory Committee, we'll move to that. So is there anyone in the room that wishes to offer public comment? Go ahead, sir. Please state your name.
Dean Trumbull.
Go ahead.
I and many other locals have a long history of mistreatment from Peace Health. Starting in my preteens, when I was struck by a truck in a crosswalk, and they failed to ever record my monthly, sometimes bi-monthly appointments complaining of back pain. Never to be recorded. So there's no history of it when it came to a civil suit against the guy who struck me in a light crosswalk. When I was 14, I began going to Peace Health's pediatric department, which after 2 appointments, they refused to see me again, stating that I was depressed and was bringing on fatigue and pain. 4 months later, I was unable to move any part of my body other than my mouth, and I was immediately flown to Seattle Children's, which at the time was the #1 rated pediatric hospital in our country. Luckily, they were able to diagnose me because a doctor visiting from Australia had seen the disease in a child 20 years prior. They said that it was a miracle that I was alive. Fast forward to 3 or 4 years later, they did not communicate properly with my doctors at the Swedish hospital or the Children's Hospital, and gave me 3 times the amount of chemo medication that I was supposed to be receiving for 5 years longer than I was supposed to be receiving it. Immediately following that, they took a cubic inch of my muscle in a biopsy from the wrong limb, and then left the appointment because they did not enjoy the amount of expletives I was using, because they had taken a cubic inch of my body from the wrong spot. I've heard far worse stories from other locals, including one of my great aunties who had gone for years complaining about abdominal pain, only to find out when my auntie flew her mother to Swedish that she had terminal colon cancer that had never been investigated because she is a woman and they did not take her pain seriously. I believe that's all I have to say for today.
Okay. Thank you very much for your comments, sir. I appreciate that.
Thank you.
Is there anyone else in the room that wishes to address the Healthcare Advisory Committee? Are there any folks online? Oh, pardon me. Please come forward.
Hi, I'm Kimla Stanley and I'm a prior Peace Health employee. And I have some concerns regarding the long-term care resident rights. I feel like they're being violated and apparently there's nobody that is really aware of what resident rights are. For instance, I understand that at resident council, there were several community members that showed up at the meeting and they were told by administration that they could not be there. And that is against the resident rights based on CMS standards. Additionally, the residents are not able to participate in community activities the way that they should be. The residents have a right to go to anything in the community that they choose to. It's the hospital's responsibility to help them get there. So recent things that were canceled were the parade. They were unable to attend. There were several of the members that are long-term care residents that were unallowed to attend the picnic, the senior picnic at Ward Lake. And it's most of that is due to staffing. Happy to provide regulations for anybody that wants to know what the actual regulations say. And I believe in the city lease, it does say that long-term care is listed in there and that the lease says that they are required to adhere to all regulations. So that's the violation of the lease.
Thank you, Pamela.
Thank you.
Just, sorry, I should have asked this of the first individual. Does anybody on the committee have any questions?
I don't.
No. Thank you.
Morning.
Morning.
My name is Laura Jackson, and my mother is a resident in long-term care. I was one of the people that was told to leave the meeting, that was not allowed to be there. I asked for that rule in writing, and I still have not received it because it doesn't exist. So their new director went into my mom's room and verbally abused her. Apparently there was an investigation done. I don't have the results of that investigation. I don't know if it's finished yet or not, but she's back to work now. And I have concerns about her being inebriated. I don't want her in the same room. She has no reason to talk to my mom, and I want her to stay away. So I think what you have is somebody that's not a good fit. So I don't know how long she plans to stay here. I believe she was here probably to just cut budgets and cut staffing because that's what's happening. So I know one resident who in the last 3 weeks has fallen 5 times. That's unacceptable. So the activity room door is closed. So when the librarian comes to read a book with the residents, that's not happening because there's no place for her to do that. Now, I know that we all have parents that are getting older. One of the hardest things to do is to not be able to take care of and to have to put her in a facility. I don't know if any of you had to experience that yet. But when my mom first got to long-term care, she loved it. Loved everything about it. The staff is excellent. I have no complaints about any of the staff until recently. There's been, I don't know whether they're getting fired or they're leaving because they're unhappy or what's going on. But there's been a turnover that is, for the residents, scary. Because these people become their family. They live there 24 hours a day, 7 days a week. And these CNAs and RNs become their family. And it's scary for them to have new people coming in all the time and trying to take care of them. I want you to be aware of what's going on in your facility.
Thank you. there any questions? Committee? Anyone else here in the audience like to address the hack? Is there anyone online that would like to address the Healthcare Advisory Committee? Hearing and seeing none, I think we will conclude the portion of the persons to be heard, the meeting, and move on to item number 5, which is approval of the April 24th, 2025 meeting minutes.
Reviewed them, move to approve.
Second.
Scott and then Judy. Any comments, questions, corrections?
See any?
Thank you, Lori, again for putting the minutes together. Okay. All in favor of approving the April 24th, 2025 minutes, please say aye.
Aye.
Any opposed? Those are approved. Okay. This moves us on to old business, which is information, kind of standing items provided by Peace Health on Same Day Clinic, emergency department renovation, and then also capital projects. So Sarah, would you like to?
Sure.
Go ahead.
So, no new updates on the same day clinic, except for that it's called Priority Care Clinic now. No updates. It's been running very well and seeing several patients on the days they're open. We just completed the first phase of the emergency department renovation. We have the new CT scanner here. Anything that you want to add?
I don't think so. It's operational. We've done multiple patients on it already. Currently in operations this morning. Been busy.
We hope to do a ribbon cutting for that space, and we'll invite you to that as soon as we have the date and time finalized. Right now, we are working with the state to get our certificate of need for the lab. That's the second portion of the ED remodel.
Judy, did you have a question?
I did. So urgent care is no longer urgent care. Does that change, just changing the name? Did it change anything else that you do there? Because so people, anyone can still walk in or make a call and get in.
Correct. They can make a call. If they're already a Peace Health employee, they can also use the app, or not employee, but a Peace Health
But if they're
patient.
not a Peace Health patient,
They just
then
call.
they still attend.
Yes.
I think there's been some confusion about that. I know that I've received a lot of calls about that.
Okay.
That people feel that they have to be a patient. They have to have a doctor there before they can be seen at the clinic.
Good to know. Thank you for that.
The priority care just allowed them to schedule online in addition to the other ways they were scheduling before. You might be right. From our experience working in the clinic, people are using it from all over. We've had probably a third of the patients from cruise people. So the access seems really, really good.
I'm just going by my office. at
And
the
you may be
moment.
hearing.
People stopping by and
Absolutely.
telling me.
You may be
Yeah.
hearing a different group that I'm hearing,
Right,
but we're
so-
seeing people from all over the place.
And so have we let the public know that? Like, has there been something posted that now it's Priority Clinic and you can, how does the community know about these changes when they happen?
For the online, there was messages sent out to all of the patients within Peace Health that they could use that as an additional way to make an appointment.
There's also been some ads on the radio.
Radio.
There's been
about-
advertising for priority clinic
Yeah.
too as well. The operations changed not at all. Priority clinic just allowed them to engage the online scheduling too as well. It's the only change that happened, but nothing else
Why the
changed.
change in name? Is that the name of the software?
It just was the way they were doing appointments. It was to line it up with the way we're doing priority care throughout the entire system. So it just allowed them to do the scheduling a little differently, use the online computer system, which has to have formulaic appointment types and things like that. So, but the way that people access it changed, not at all, just the change. And there were advertising campaigns. I don't know if Kate is still there were great advertising campaigns about the change. They're just a little bit of a branding name change, but that's pretty much it. And from my experience, we've seen good use from community, outside, cruise people coming in.
Oh,
It's
there's no
very
doubt,
well
people are very happy with
bruised,
the
yeah.
clinic, but just the people.
So if you're hearing some pockets, yeah, people, interesting to hear where they're coming from.
Yeah, it was a bit unfortunate about the timing. Peace Health aligned all of our urgent same-day care entities across the organization at about the same time, pivoting them from multiple different names in our Oregon, Washington, and Alaska entities to priority care to kind of systematize, make things kind of easier for particularly our folks in Oregon and Washington. If you're transferring between different facilities, you kind of have that similar, oh, this is what I'm getting at each place. Because we have that multiplier effect here, we get to benefit from being in a part of a big system. We also kind of have to align with them when shifts like this happen. And as Dr. Horton already said, it was largely just a naming convention, and then we added the bonus of being able to make appointments online for those who are already panel patients. But with that, few things that we did, a lot of social posts. We did a few things through radio, and then I have flyers that get sent out all throughout our Visitors Bureau entities that are priority care. So we get a lot of our visitors that come through. And then one thing that I wanted to highlight is that we have a really great partnership with Priority Care and the Mobile Integrated Health Program. That has been just a phenomenal benefit that we're really capturing. I was talking to the paramedic Ben Watson a couple weeks ago about our relationship and how that's worked out. And he was highlighting how he is able to see a patient and out on the streets that often have some challenges, that making an appointment and sticking to an appointment is really challenging for some of those folks who either have transportation issues or mental health issues. He's saying being able to transport them and get them to a clinic where they don't have to adhere to a specific time has gotten them in and then alleviated an emergency department visit. So capturing them before they become emergent. And that's really been a very huge benefit and a great partnership between those two entities. So we're really proud of that and that relationship. And he's spoken very highly of the ability for him and his clients to work well with that.
Thank you for that information.
Absolutely, it's really good. I can't praise MIH enough. It's been so neat to see how that has had multiplier effects throughout our community and within our facility as well. So it's really encouraging to see.
Thank you.
Kate.
It would be nice to know if you have pockets of people that aren't hearing. Let us know generally who they are, so it can open up another, way to advertise or whatever. I think in town it's hard to know how to get to everybody.
Facebook. I'm sure.
Yeah.
That's where I get all the messages.
Sure.
If they don't come in. But thank you, that was great information.
Are there any other questions on the priority care clinic or the ED renovation? That's great that the first phase is completed. And there's 3 phases, correct? So
Yeah.
this will still be going on for
Yes.
quite a while.
Right.
Yep.
We need to get the lab moved so that we can have the space to expand the ER. So.
Okay, great. Okay. So item C is, if we're good with those 2 topics, an update on capital projects at the hospital. And Amanda and Scott have had a number of kind of back and forth conversations. We've had a few meetings about this, trying to get a handle on the capital projects that were listed in the lease that frankly we haven't really been keeping pace with for a variety of factors. I think we're still working on that, but I was hoping Amanda and Scott, if you can just sort of share where things are at and the things that have taken place recently at the hospital.
So recently, we were able to complete finally the roof warranty issue at the clinic building. The original roofers came into town and mechanically fastened the roof to the deck structure. They put in many rows of long fasteners through the membrane and then re-adhered and welded membrane on top of that. And they also re-adhered the parapet wall where it was billowing out. We did investigate, and it doesn't seem like there is any interior air coming up through that wall, which is great. So it doesn't seem like it's going to delaminate, I guess is the word. So it's stuck down pretty tight. We'll see in our next big wind storm, we'll go look and make sure that everything's holding down tight. But they put, probably over 1,000 fasteners down in there in long rows down through the valleys and re-adhered everything really well. So I think it'll do the trick, which is great. It was a long process to get them out here. I have had many conversations over a few years to get them down here. So I'm just excited that that's finally done. It's one of the last things ticked off my list for warranty things. So that's great.
That's great.
Yeah.
Thank you.
Yeah.
Great work.
As far as capital projects moving forward, we've started the process of kind of looking ahead. We still have conversations to have, but I've grouped them into 2 separate entities, more kind of mechanical and HVAC projects that'll happen within the building, and then exterior projects, roofs, windows, and siding, and those types of things, and landscape type things. So I think from there, we need to get together and prioritize what those would be and when they would happen. And I think that's our next step. So I've kind of put some basic numbers together on just placeholder numbers for now moving forward. And then we'll get together and kind of figure out what projects we want to happen when and how much we'll budget for them. Based off of the list that we've been working on.
Well summarized.
Yeah.
Yeah.
Perfect. Thank you,
Looking
Amanda.
good.
Okay. And I'll just add that the city is starting its 2026 budgeting process. We have done some work on capital, which is much earlier than we usually do, but we still have quite a bit of time so that as this process gets finalized, we can incorporate it into the 2026 capital improvement program for the city. Yeah. Any questions on capital projects? All right, this moves us on to new business. There were a few items that were brought up by Councilmember Judy Zengi. And Judy, I don't know if you want to touch on them or you want me to just kind of go through them. You can have conversations about some of these things or.
Yeah, I just would like an update on these, just
Yeah.
to hear what's going.
Sure. So currently we have been able to meet the requirements of having all of our clinics and all the physicians to run those clinics. For the lease, we do have a couple of positions open in primary care and anesthesia. I am excited to say that we interviewed a primary care physician this couple weeks ago, and he has signed a letter of intent to start in December. So that'll be great. We've also added a couple of things that weren't in the lease, and that is, can you speak to the pediatric psych?
Oh, yeah,
Yeah,
sure.
that-
There's
that-
a-
that's new, and she's starting in.
Yeah, there's a pediatric psychiatrist that's was hired by Bellingham, but with the agreement that she would cover us up here too as well. So she's been given, I think, 1/4 of her schedule or something like that, or 1/5 of her schedule to cover patients up here. So she's coming up for the first time in August, mid-August. So that's real awesome thing. So she's going to do telemedicine visits from down south, do her new intakes here in person, and then cover kids down south. So very exciting.
And then our dermatologist that's coming quarterly. Which is great.
So I don't know where you all travel in the community, but folks are looking and asking, why do we have such a big turnover at the hospital? Why are all our doctors in it? And so that's why I put this on there. I think it's important. I've heard from previous folks who worked at the hospital, they said, well, sometimes they don't like the weather, sometimes they just, their spouse doesn't like it. But the fact of the matter is most of them stay in the community. They just go work elsewhere. So I just wanted to make sure that you folks are aware of that people are concerned about that. They start with, one provider, and then they either have to change facility or find a new provider. And I think that that says a lot about retention and recruitment. Maybe we're recruiting the wrong people. Maybe they don't like the island. I don't know. But I just want to know, is there something that we could do to help that? And if there is, if you could let us know, because I think that kind of goes to the next item, which is the compact. I mean, is there something that the city could do to help move that along? It seems like, I remember Dory.
Right, and it didn't get passed in the early stage of legislation. There is on the Alaska website a place where you can email and put your any requests that you have in favor of the compacts licensure. So that's helpful to do that. I know some of the things that have been hard for recruiting. One of the biggest things that came up was our schools. The state of where our schools are right now. We have had some physicians ask what is available for their children and not thrilled with what we have to offer. The other issue, right now we have Dr. Stryker, who is a fellowship trained total joint orthopedic surgeon, which is awesome. Most communities that our size would get a generalist orthopedic surgeon. We have somebody who has gone to extra lengths to get trained in total joints. And then we have Dr. Shirkowski, who is a sports medicine trained orthopedist. And to have both of those here in Ketchikan is pretty dynamic, especially because there's only one other fellowship trained orthopedic surgeon in the state of Alaska. My concern about keeping him is our volumes. Insurance with the city and the borough and the state. We're not a preferred provider for you all. So people are going elsewhere. That makes it really difficult to keep somebody in a specialty like that wants to do 1,000 cases. So.
Awesome. Thank you. So letter or email from us would be helpful.
Yes, that would be helpful.
Sarah, can you send us the state
link?
Yes.
Yes, I can send that.
And then the third one, actually, we spoke on that in terms of changing the policies and how we communicate that to people. The number of comments though submitted to the patient portal, I don't think I've ever seen how many and I ask this because people bring me in their photocopied, printed off documents, and I'm like, you shouldn't be bringing me that. That's a HIPAA violation. I don't want to know. I'm just, your name is plenty. Just tell me that. But I've never seen, numbers. So I don't know if I didn't get it.
No, I'm not sure, Judy. I'm not sure if that's ever been provided as part of kind of the regular reports that we get from Peace Health. I would defer to our Peace Health folks on your ability to do that, or if there is a HIPAA violation. But when Sarah and I were speaking the other day, can you share a little bit about what regulations are in place in terms of how quickly you have to respond and resolve?
So CMS has guidelines of, depending on the type of issue that is brought forth through the website, when we have to respond and the steps that we have to do. And I wasn't able to get a number of how many we've had, nor did I know like the timeline you were looking for. But I was able to get that we have been on track and have met every single timeline per the CMS requirements to respond.
I don't think I'm looking for you to but I just want to know how many numbers, just numbers. I don't even want names. I just want the number that has, are people using that site?
Yes, people are
And
using
are
it.
I'm assuming there'll be there's compliments, there's people who are pleased, there are people who aren't pleased, and then there's just the general stuff. I just kind of would like to know. Because that was a big deal for us to put that in the lease. A lot of people really wanted that. And I just want to know, well, are they using it? I mean, and if not, why not? I know myself personally, because I had people ask me, they told me it was difficult to find a couple times. I had trouble finding it. That was resolved. So I'm just curious as to, where we are with that. Is it working?
I think it's working. We've seen comments come through both. I'm sorry, I've got coming
And
over a
that's
little
all I
cold.
have for today.
Okay. Yeah, like the positive ones we get to share with our teams, because so many of them are about the staff. So we share those in our monthly newsletter and in our daily huddles. So they're being used because we get a lot of good comments.
Oh, I'm sure. I've never heard of anything unflattering about any staff member. Are there going to be comments at the end of this?
Sure. Yeah, absolutely. I realized that we didn't put that on the agenda.
I know. Okay.
Okay. Were there any other questions from the group, or Judy, if you had any other questions? Thank you for bringing those items up. I think we'll probably have more conversation about them in the near future.
I have one. So we review the lease in 2026.
In 2026, yep.
Okay.
Mhm.
Is there a time set yet, or am I?
So it's by the 5-year anniversary of the lease signing. So that would be in October of 26. So we have quite a bit of time. And because I don't believe this is spelled out the process very well in the lease, so that's something that we'll have to develop. So that 5-year review really looks like. Okay. Any other questions? Those items on the agenda? Hearing that goes on to future agenda items. We had a few things that meeting didn't really suit this meeting. One of them being a 5-year review process. So coming months, Sarah, you and I should probably start talking about that. And then another item that was brought up at the last meeting in talking about the emergency department remodel and the number of rooms. And I think it was Scott that said that that was based on population served, not, I don't know, another factor. But I think you were going to try to get that for us, and that's not obviously a big involved item, but just to better understand relative to the plans for the emergency room, because it's not about necessarily making more rooms and more capacity, but making it more efficient and having better flow through. Right.
Yeah, that's kind of the goal. We do have, Eric Blake is the one that has been working closely with the state, closest with the state, on that particular topic. So I think either I can meet with him and get some better detail around what that process looks like, and or maybe he can come address the committee the next meeting, one of those two.
Might be good, yeah. Are there other items
Not right
for
now.
discussion in the future? None? Okay. So yeah, I didn't put it on the agenda, but I guess that would bring us to comments from the Healthcare Advisory Committee, and Judy will kick it off with you.
So the two ladies that came up to speak, I happen to be one of the folks that was invited to that meeting. And for those who don't know me, I've been a court visitor for the state of Alaska for a very long time. So I would be the person who reviewed guardianships and made sure that they were working correctly. And so I spent a lot of time up in long-term care. I always felt welcome. The staff have always been outstanding, but I have to tell you, on that day, I was embarrassed. I've always been proud of my hospital because we take such good care of our people. I was intimidated by that lady, and I can't really remember her name, although I wrote it down yesterday and I can't find it now, but I was embarrassed for all of us. It's not how we treat our seniors. These are the people who have built our community, and we should be there supporting them. That did not happen. I felt like I was probably a hair from being thrown out by security. I mean, it was that uncomfortable, and I'm a pretty tough broad, and it was not a pleasant experience. So I would encourage you to look into that, investigate that, because this is their home. These people, this is their home. They shouldn't feel that way. And you could tell by their body language that they were intimidated as well. And I don't think that at, 80, 70, you should be at a stage in your life where you're afraid to speak your mind and be intimidated. So I would just ask that we look into that, because we are proud of our hospital. But we can't put up with this. It's not fair. So that's my comment.
Thanks, Judy. Amanda, any comments from you?
I do not have any.
Okay. Dr. Horton? Okay. Scott? Sarah? I would just like to thank everybody that came here today, especially because we did change the meeting. We normally have a pretty regular cadence, so I'm happy that people found out about the meeting and were able to come. Same to the folks online. This is absolutely a forum. One of the points and reasons for having the Healthcare Advisory Committee established was to hear these types of comments and to create a space and a forum for conversation surrounding our hospital and our services. So I really very much appreciate everybody coming today that spoke and wanted to listen. And as Judy mentioned, some of the comments, they sort of fall back to Peace Health to deal with, not necessarily in the realm of the Healthcare Advisory Committee to take on. But I would say that your comments have absolutely been heard, and I would, I'm reasonably assured that the folks at Peace Health will be taking those seriously and having more communication as needed about those topics. So. And I think that concludes our meeting, unless there's any other comments. I think we will adjourn. There's no objection.